Hello everyone. Today I want to talk to you about how over investing emotionally in dentistry can be draining, can kill your career eventually as well, can affect you mentally. I want to share with you some examples as well of what does it mean and how can you hopefully avoid it. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And I took it from 1 chair to 10 chairs, from 3 team members to close to 40 team members over the course of 15 years. And you can check my details below for credibility. So what does it mean, or what do I mean by saying over investing emotionally in dentistry? For example, dentistry, as any medical procedure as well, and many surgical procedures, carries risks and complications. So let's say you're doing a difficult root canal treatment. In that case, there's a high risk of perforation, and a perforation happens. That's a complication, and there's ways to deal with that. And then eventually, you get dragged into the thought of this complication, and you keep thinking about it day and night, and you keep questioning your abilities, you question yourself, and you just think about it every day. And the way you see teeth, because as dentists we train to see teeth, are very important. It's much higher on how patients see teeth or how they value teeth as well. So there's a huge discrepancy between how dentists value teeth and how the public and even medical professionals value teeth. And because of that, you can easily get dragged into over investing emotionally in your dental treatment. I want to give you 2 examples on how this discrepancy is huge. First example was a soccer or a football, or English football game. It was a few weeks ago. I was watching the game between Liverpool and a team called Plymouth in the FA Cup, which is a cup in a tournament in England. One of the players got knocked on their face, and they had a complete avulsion of the front tooth. The entire front tooth, the center, was out. The interesting 2 things is the camera was heading towards the manager of that team, and the manager was standing on the line laughing. Sport is harsh. The manager was laughing about it. Now, this player was hit on the knee or the ankle, or one of the muscles were torn, or hit in the eye or the head. The patient will not be laughing. Secondly, they stopped the bleeding, and the player continued the whole game with a missing front tooth with no problems. So for us dentists, losing a front tooth is a disaster. It's an emergency. We will think about it all day and night. Oh my God, my patient lost their front tooth. It's a big deal. But for an average, not average, just a professional footballer, eyes and their manager, it's not a big deal. They laughed about it and they laughed it off. Another example as well shows the discrepancy, and that's a medical professional. As a dental student, I was working for a top endodontist, world-class endodontist in Egypt. I mean, if I compare him to endodontists around the world, he's up there as a top. He's talented, he's skilled, he's experienced. He ticks all the boxes to be one of the best in the world, not just in the country. He's the one you refer a case to where everyone else will deem hopeless or cannot do anything about it. He had his microscope on, he had 3 assistants around him, he had the patient on the chair. He worked for 5-10 minutes on the case, did everything he could. Then he realized this tooth is hopeless, needs to be extracted for multiple reasons. He sets the patients up, and I'm talking to this top professional who's trained to deliver those news every day, because he's an endodontist. He can tell the patient it's not saved, or we can save the tooth, or we cannot save it. Sets the patient up, he looked at the patient and tells him, look, I'm really sorry, I want to bring some news to you that you might not be happy with. I know you came here to save the tooth, but I want to. And the patient interrupted, like, hey, just tell me what's going on, why are you making a big deal of that? It's like, I'm really sorry, we have to take the tooth out, we cannot save it. It's like, come on, that's fine, just take it out. You're acting as if you're going to remove my uterus or doing a hysterectomy on me. No, the patient is saying the analogy because the patient is a obstetrician gynecologist, so he's a medical specialist. And he is trained to deliver bad news to young females who had never had kids before, that they will have to have their uterus removed and they will never have kids again. So now you can see the discrepancy between the importance of teeth and the importance of other organs in the body, and why us dentists, we treat this complication as if we're dealing with an eye complication, we're dealing with a uterus complication, we're dealing with a full knee or leg amputation or a heart surgery. If we just, and I don't want to be misunderstood there, so I'll explain myself more, but if we just relax a little bit about how we see teeth, it might free us and make us better dentists and make us perform with less stress, and by default will provide even better dentistry. So this is not an excuse to underperform. Still, you want to provide the best care, the best dentistry you can ever provide. And if there's a complication, patients don't like to be left in the deep end of the complication. You tell your patients, there's a complication, I'm with you to help you fix it. I'll refer you to the required specialist. I'll do what I can to help you fix it. If we can do that, but then once we finish that, we don't get dragged into it and we just block it completely and move to the next case, hopefully we can perform at a much higher level and at a world-class level. Similar to professional footballers or tennis players, when they miss a point, miss a goal, miss a shot, they don't think about it the whole game. They move on to the next point. So I hope by just changing how we value teeth emotionally, it might free us to perform better dentistry and become better dentists and not get dragged into a complication or into a negative mindset where you just keep thinking about the complication all day and all night. So again, this is not an excuse to underperform. It's actually an invitation to overperform clinically, but underinvest emotionally. If you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.